And welcome to tonight's Celebrate One Town Hall. Safe sleep saves lives. Real talk, real solutions. I'm Janelle Coleman, your moderator for this evening. My day job, I'm the president of the AAP Foundation. We're very proud to support the work of Celebrate One, and I'm very honored to be your moderator tonight. Before we get into the meat of the program, I do want to say thank you to First Church for hosting us in this beautiful space. And in First Church fashion, of course, we have a message from Bishop Clark. We will turn to the video and then come back to our program. Thank you.
This is Bishop. As you can tell, I am just finishing worship and I'm sitting here in the sanctuary, but I wanted to take a moment to record this video because regretfully, I cannot be with you today. First of all, let me thank Brother Ted Murdaugh and his staff for everything that they are doing, as well as our mayor and the members of city council and all of our partners who are helping us as we seek to turn the tide of what is an unacceptable rate of infant mortality. Listen, beloved, we can do better, and we have to do better, and we will do better as we work together, cooperatively and collaboratively, to bring about positive change. The Bible tells us in the Old and New Testament of times when there were attempts to bring about infanticide, the wholesale, wide-sweeping killing of innocent children. And the pain of that is often seen as one by one, mothers lose children in the first year of life. Beloved, our city is better than that. Our community is better than that. And I pledge that all of us working together, we will see a change. I wish I could be with you today in the listening conversation. I pray for positive results and for tremendous return. God bless you.
Thank you, Bishop Clark. Bishop, yes. Bishop always brings a word of knowledge and peace and comfort. And if you don't know Bishop Clark, now you do. And I must say, I'm very glad that that video played because no one can stand in for Bishop Clark. So very, very glad that we had the word from Bishop Clark. As the bishop mentioned, and it's been mentioned already, we are here tonight to discuss a serious issue of addressing infant mortality in our community. It's a conversation we must have, and it's imperative that we come together as a community to reduce infant deaths in Central Ohio. We are here tonight to focus on preventable infant deaths, those deaths attributed to sleep-related deaths that we can prevent. So, while infant mortality is that and so much more, tonight we are laser focused on where we are and what we can do to decrease sleep-related infant deaths and get more babies to celebrate their first birthdays. And yes, we have experts here tonight to help us through this tough but necessary conversation. This evening, we will have a one-on-one conversation with our mayor, Mayor Ginther, who launched Celebrate One to galvanize this community to address this concern. We also have panelists who will walk us through interventions and how to support families and next steps. As I ask the mayor to join me on stage for our conversation, let me introduce tonight's panelists who you will hear from throughout tonight's discussion. Please stand where you are as I call your names. Maureen Stapleton, Executive Director of CelebrateOne. Jeff Klingler, President and CEO of Central Ohio Hospital Council. Dr. Camila Dixon, Medical Director, Moms to Be. Olivia Atley, Certified Doula with CelebrateOne. And Seneca Bean, a parent living with infant loss. And Seneca is also an author. Thank you all for being here tonight. And I also want to thank those of you who are joining us via Facebook, Instagram, and YouTube. Welcome, and please share tonight's live telecast with your friends and family, and quite frankly, your entire community. And so with that, we will get started and have a conversation with the mayor. Thank you so much for joining us, Mayor Ginther.
Thanks, Janelle.
Tonight, we are sounding the alarm about sleep-related deaths in our community, and more specifically, as it relates to preventable infant deaths in our community and the impact on the Black community. Mayor, you launched CelebrateOne way back in 2014. And you continue to make infant mortality a priority in your administration. Can you talk to us about why this has been so important to you and why it's still important to you?
Yeah, I think it's really important when you focus on a particular issue and devote resources and build public-private partnerships to address it, you kind of owe folks your why, and I'll get to that in one second. But I do have to acknowledge some incredible First Ladies who helped launch this effort and have helped us along the way. We have First Ladies Ross, Gilliard, and Troy here. Would you all just wave a hand so we could thank you for, these are incredible women that have been with me since the very beginning when we launched this effort, and it made a huge difference for our youngest neighbors. So it's back in 2013. It was Clara's 3rd birthday. My daughter was born on July 23rd, and there was a group gathering at the Lincoln Theater on the Near East Side to talk about infant mortality and racial disparities. And Dr. Art James and Dr. Pat Gabby were kind of the lead agitators and instigators that got me into this space. And Dr. James was facilitating a conversation there at the Lincoln, and I asked him to go early on the program so that I could get home to celebrate with Clara her birthday. We were going to take her for ice cream and so forth. I had just recently become council president and was trying to figure out how I was going to use this position to work on issues important to the community and trying to figure out what that issue would be. And when I left there that night, learning that we had a crisis here in our community with all of the resources, incredible health systems and incredible partners and faith community and everything else, I realized this is what I was going to focus on and was going to use my power as then the council president and since then mayor to focus on. Dr. Roberts, our health commissioner, really talks about infant mortality being the canary in the coal mine, because it's driven by social determinants of health and by racism. I mean, and we just have to acknowledge that. That's what the science, that's what the research tells us. If you look at where the highest concentrations of infant mortality are, you will find that's also where the highest instances of violence, of evictions, of displacement, lack of access to jobs and transportation. all those social determinants of health that contribute to higher infant mortality rates, and those disproportionately impact African Americans. We have seen some great progress by stacking hands as a community from 2014 to 2020. I think something like a 28% reduction in infant mortality overall, a 22% reduction amongst African Americans, because when we started this work, African American children were 2.5 times more likely than white children to die before their first birthday. Then the pandemic happened. And there's been a dramatic shift. Now, I think if you look at 2020 and 2021, our infant mortality rate has only gone down 16% since our work started, and in the African American community, 3%. One of the most alarming things that we've looked at as a CelebrateOne team is the sudden increase in sleep-related deaths of young babies before their first birthday. And think about this for just a second. These are the most preventable deaths, and something that we can take immediate action on as a community. Many of the churches and other groups have hosted sleep ambassador trainings and helping more folks who aren't just parents but caregivers, extended family members that can help make sure they're putting the youngest children in our community safely to rest. Child care providers, other partners in the community. 79% of the sleep-related deaths, 79% of the sleep-related deaths in 2020 and 2021 have been amongst African American babies. And we, as a community, we know what we can do. We've seen the progress that we've made, but we have to be jolted, called to action when you see this type of increase, particularly amongst deaths that are so preventable.
Mayor, you have made a point to talk about racism and to point out that sleep-related deaths have significantly risen, but especially in the Black community. The disparity is alarming, and as it's been stated, most sleep-related infant deaths are preventable. Director Stapleton and others will talk a little bit more about interventions later, but Mayor, can you talk to us about it? Because you've been doing this work for a long time, and I would suspect continue to learn all the time about what we can do to prevent these deaths.
Well, one of the reasons we declared racism a public health crisis several years ago was we saw the disparities in the health inequities and health disparities in our community. And you can't get away from the fact that race is oftentimes at the heart and center of that. And so, people hire mayors to solve problems, and the best way to solve problems is to acknowledge that racism exists and that it is driven and contributed to health disparities and health inequities, and then determine how you're going to address it. And you have to do it through that lens of equity. Equity is different than equality, and you have to be purposeful and intentional about looking at data, determining what strategies and tactics you can use based on evidence and based on data to go after those disparities, to really have a laser-like focus on the disparities. And so when we talk about sleep-related deaths within the African American community, we need all hands on deck. We need more folks to step up. Our fraternities and sororities have been incredible partners, faith leaders, other community partners to help with sleep ambassador training, to help raise this issue of safe sleep. We've been pushing a message out consistently about the ABCs of safe sleep, and the much smarter experts that you're going to talk to later on will help with those things. But the bottom line is the ABCs are alone, on your back, in a crib. Babies should always be put to rest for naps or for their rest at night, following those ABCs of safe sleep. But I think it's a much more powerful, and I know First Lady Gilliard and I have talked about this before, young women and families, in our churches, in our neighborhoods, in our communities, message matters, but so does messenger. I am the mayor. Regardless of the message I have, I may not always be the right messenger. And so I need our neighbors to help us carry this message, messengers with great credibility and influence, particularly with families, caregivers, and loved ones.
Thank you. And I love this notion that all of us can be a messenger.
That's right.
And a messenger for good.
That's right.
Individually, but also collectively. And we know that a lot of that work is getting done through our partners, who we will hear from a little later. But Mayor, I know that the partners would not be as committed and as excited without your leadership, knowing that you have their back and that you're committed to making sure that they are able to press forward and make a difference in our community. So thank you for that.
Thank you.
We are now going to move to our panel discussion, but before we do, can we please give my mayor a round of applause? Thank you. Thank you. And as we are waiting for our panelists to come to the stage, we do have a brief video that we would like to show at this time.
Practicing safe sleep at 2 a.m. is hard. It's okay to ask for help. Connect with a friend, another mom, your partner, a safe sleep support group. Connect with whoever you can to stay awake so you can put your baby to sleep safely.
Okay, great, thank you. Hi. Hi. You all move fast. So, Director Stapleton, Dr. Dixon, Jeff, we've heard the alarming data about where we are in terms of preventable sleep-related deaths in our community. And the mayor has challenged all of us to take action and to be messengers. Can you talk a little bit, Director Stapleton? I've made you a doctor too. I know. Can you talk to us, Director Stapleton, about the conversation we were just having with the mayor about the data and the alarming rise of sleep-related deaths in our community? Talk to us a little bit about why this is happening, but I think also in terms of why we're having this town hall tonight and why it's so important.
Thank you. So we know that traditionally over the last several years, we have seen 14, 15, 17 deaths related to sleep. And we typically, after a fatal infant mortality review board, determine what causes that death to occur. Those numbers typically range again from 14, 15, 16, 17, and some of them are congenital. Some of them are related to other issues, but some are classified as SIDS or other issues like putting a baby down incorrectly. And so over the last several months, we saw an alarming rise, and there have been 24 deaths in the first 3 quarters of 2022. That's higher than the entire year of 19, 20, and 21. And so as we talked over the summer with the team from CelebrateOne that you see all around the room, we determined that there had to be something else that we needed to do. We have had incredible support from our churches, from our community-based organizations, but something post-pandemic has caused this rise. And so first, it's sounding the alarm. And it's asking everyone in our community to be aware of it and to take active steps to help us fight it. Second is to come up with some different strategies that you'll hear a little bit tonight. But the reason we're here tonight is because 24 babies died preventably last year, and that's only for the first 3 quarters, and we're suspecting that number will rise with the final data for 2022.
So, Director Stapleton, what has CelebrateOne done, and what are you doing today to help reverse the rise in sleep-related deaths?
So, community education has been our major key to what we believe was our success. With the help of Franklin County, with the help of our community-based organizations like our churches and our lead entities and our partners, we have developed and implemented Safe Sleep Ambassador and Safe Sleep Ally training. One's a little longer than the other, but ultimately it gives families and individuals the tools to put a baby down alone on their back and in a crib. So we know that people, when they know better, they will do better. But our community health workers are at the case every day. When they meet moms and we begin to engage with families, we immediately ask them if they're pregnant. We want to send you to Safe Sleep training. Let's give you the contact information. Let's make sure you've signed up. And as a result of you signing up, you can come back and get some additional resources from us, because we want you to be able to put your baby down the correct way. And so our community health workers are very skilled at finding people where they are, meeting people where they are, and going to where moms and families are. This also, I think, is important to note, Janelle, this is not a mom and dad problem. This is a family issue. This is a babysitter issue. This is a neighbor issue. Anyone who is taking care of a baby needs to know how to appropriately put a baby down and have the correct tools of not having things in the crib, making sure that they're on their backs, making sure that they're alone, all of the things that we know that lead to success and better outcomes.
So, Director Stapleton, you talked about having the conversations, and that it's not just with moms, but it's with all individuals, all members of the community. So how do you talk about safe sleep with individuals and members of the community? And how are we even talking about safe sleep with our hospital staff, the first person or people that the moms are interacting with before they go home?
Yes. So I think the whys are as important as the information itself, you know? And so our community health workers are trained to not only give you the specifics and the correct data on how to do it, but why is it so incredibly important? Why is it important not to put a baby on a soft surface like a couch? Why is it important not to have multiple items in a crib or a pack and play? Why is it important to ensure that a baby is sleeping alone and not with a baby brother or an older brother or an older sibling or even a parent, where someone can roll over and cause harm? And so our community health workers not only train on the specifics, but they also talk to families and educate families on the why. The why is as important because that's what leads people to understand the severity of making those wrong decisions. As it relates to our hospitals, I can't begin to tell you how special I think Columbus is in this respect. We have our hospitals through the Central Ohio Hospital Council, our medical directors and our federally qualified health centers through representation of the Ohio Better Birth Outcomes Collaborative at our table monthly, working through, talking through, reviewing data, and keeping up on what is happening in our community. That doesn't happen everywhere, and so we have seen the success because of the collaborative nature of our effort here. The hospitals have really interesting, cool tools that you'll see in a few minutes that parents are engaged with while they're there. to make the difference in terms of the education. And we're even talking about doing some additional kinds of tool development to ensure that parents actually have what they need. But our hospitals have been incredibly important to the effort. And you need to know that our hospitals and OBO have measures in the overall Franklin County strategic plan for infant death or infant mortality that they're responsible for. And so the numbers of sleep sacks, the numbers of parents trained, that all of that is a part of our plan, and it's reviewed on a quarterly basis.
Great, thank you. And so, Jeff, as Maureen mentioned, hospitals play a critical role in helping to reduce what are often preventable sleep-related deaths. And I understand that before new parents are able to leave the hospital, they're required to watch a safe sleep video, and they receive take-home packets with door hangers that have safe sleep tips on them as reminders for moms and caregivers on how to put their baby to sleep safely. With all of these materials and tools, what are you hoping to accomplish by requiring moms to watch a video and making sure that the families are leaving with these additional materials?
Absolutely. Are we on? Okay, we're on. Absolutely. So thank you, and Maureen. Thank you for the kind words. I think it's really important. Janelle, you mentioned in your comments. Maureen, you mentioned in your comments. Mayor as well. Largely these sleep-related deaths are preventable, right? And the number one intervention for prevention is education. So when you think about all the avenues for providing education, hospitals are key. It's one of the very few places where we truly have access pretty much to all folks who are delivering a baby. For the most part, we go to a hospital to deliver our baby, and we think that's just really important that we provide as much education as possible in that 2.5, 3 days where we're in the hospital with moms, dads, babies, to provide that education. So a couple of years ago with CelebrateOne, and that's the beauty of doing it with CelebrateOne, is that we're consistently providing the same consistent education, developed a video that covered not only the ABCs of safe sleep, but also the health benefits of breastfeeding, the dangers of smoking in the home, and the importance of having a support team, especially in those younger years. And so it's about a 7-minute video that we do encourage every family to view before they're discharged from the hospital. And so not only do we try very hard to show this video, again, it's about 7 minutes, really gives an opportunity to go really that deeper dive into those ABCs and those other issues. But we conduct audits. We monitor ourselves. As Maureen said, we're accountable. We're accountable to the community in making sure that every parent views that video before they're discharged from the hospital. So every quarter we do audits, and we're at about 92, 93% of the time parents are seeing that video. Now we're going to get to 100%, but we're happy with 92, 93%. We're going to strive for 100%. To make sure that education is happening consistently among every hospital. So if you are delivering at Mount Carmel St. Ian's in Westerville, Ohio Health and Doctors on the west side, or OSU Wexner, all 8 of our birthing hospitals are providing the exact same education to the community, and we just think that's really important. We also think, Maureen, to your point, that it's not only important to educate the parents, but anybody else who's going to watch that baby. The grandparents, the aunts, the neighbors, the babysitters. So we also provide, got my props here, we provide everybody before they leave the hospital with a door hanger. And this door hanger is actually referred to in the video. And we ask parents to take this door hanger and hang it on the baby's room's door, or whatever room the baby is sleeping in, and making sure they're sharing this information is the same information that's covered in the video. The importance of the ABCs, the importance of not smoking in the home, benefits to breastfeeding, all those things, share this with anybody who's going to watch your baby. And so we think between the parental education and then the education of others who perhaps are watching that baby is going to be key to lowering these deaths going forward.
Thanks so much, Jeff. And thank you for bringing the props.
Absolutely. Absolutely.
The examples. Visuals are key to learning, right?
And these are out on the table out front, so please take some with you. I brought a whole stack.
Thank you. So, Director Stapleton, CelebrateOne, right? That the name in and of itself means that we are striving to accomplish something and to truly celebrate. A large part of that CelebrateOne mission and approach is all these people out here, right? Partners and connectors. I think you call them community connectors. Can you talk about your community connectors, who they are, and why they are so important to making sure that we are reducing these preventable sleep-related deaths?
So we have a number of levels of connection to the community. First, we have our community health workers who are community connectors and navigators. Ladies, and we don't have any gentlemen right now. Ladies, raise your hand if you're in the room and you're a community connector or navigator. We have about 14 of them at a high point. We're still looking for a few more, and they do nothing but going and engaging. But then we have 13 lead entities who are all leaned in on this effort with us. I see a couple of them. I don't want to mess up too badly, but I see Franklin County Health Commissioner Joe Mazzola. Franklin County Health is now a part of our lead entities. And then we have a variety of partners who range from small community-based organizations, churches. So glad to see the First Ladies in the house because, again, as the mayor said, the messenger is often the key to getting the message across. And it may not be me, and it may not be the mayor, and it may not be that video that makes the difference. It may be a trusted member of our community that makes the difference. But then we also have, as a city, a very progressive thought about having partners who not only can get a baby to one, but we have a 0 to 5 strategy. There are some things that we have to do before a baby's born. There's some education that has to happen before a baby's born. And then once we celebrate that first birthday, then it's to get that baby to 5. Actually, we're joined tonight by our new future-ready CEO, Mario Bazur. Mario, raise your hand. I'm glad to have him in the room because he is a part of the continuum, right? Mine is to celebrate 1, but our city's is to celebrate 5, 10, 15, 20, and 25. And we can only do that by having all of those partners in the continuum.
Thank you. Dr. Dixon, we know that through a partnership with Nationwide Children's, OSU, and Ohio Better Birth, you're working to address better outcomes for these infants. Can you talk a little bit about when it comes to reducing infant mortality, how crucial it is for trust to play a role in interacting with our healthcare professionals, especially for mothers and families of color? We've heard words like cultural competency training amongst our healthcare professionals. Language is very important. So these types of things are at the forefront of your work. Can you just help us understand why this is so important to reducing infant mortality?
Thank you for that question. It's on. So that is extremely important, engendering trust in the community, especially when we look at the disparities that we have in infant mortality. We know from the numbers, if we look at the sleep-related deaths, if we were to eliminate those between 2018 and 2021, we would actually be meeting our goals for infant mortality rate. And then if we looked further at the non-Hispanic Black community, if we were to eliminate those preventable sleep-related deaths, the infant mortality rate would be 8.6 instead of 13.2 through September 2022. So this kind of speaks to the other fact that we know we have a huge disparity when we look at infant mortality, and that trust part is extremely important. So there are many different things that we've done to look at that and really get the social, get our cultural sensitivity up in the community. So one of the things was actually with a collaboration from Ohio Better Birth Outcomes and CelebrateOne, they received a grant from Ohio Department of Health, and through that they did listening sessions. In the listening sessions, they found 3 major themes. So one was really trust and communication. The second was increasing representation of the providers. And the third, unfortunately, was experience of discrimination. And as a complete aside, I work at Ohio State, and I'm actually here representing, in this segment, Ohio Better Birth Outcomes. I'll be with Moms to Be in a second segment, so I have this hat on now. But interestingly enough, my team at Ohio State actually has led a project as well where we got funding from Ohio Department of Health, and we found similar issues of discrimination as well. So we know this is really important. So there are many things that we've been doing to do this. So that was that first study. The second thing that we've done actually started today. I was up at 5:30 this morning, so excuse me. But we started our Addressing Racism in Maternal and Infant Care series of lectures. So I gave the first lecture this morning. We have 2 more coming in the next 6 months or so. And it's open to the entire community. So it was really exciting. This morning, I think we had 180 people who came voluntarily to listen to the history of racism in reproductive care. So we are really getting the message out there.
Great. Thank you so much, Dr. Dixon. Thank you all for the information that you've shared, the resources. Jeff, your materials, thank you again for having those. I want to make sure that the audience knows that members of the CelebrateOne team are here if you have questions after the program. And for those who are tuning in via Facebook or other social media, you can visit the website, columbus.gov/CelebrateOne, or call 614-570-3592 for support and information. Thank you all for being here. We're going to shift to our next segment, but first, we are going to watch another video about supporting families and moms to help prevent sleep-related deaths in our community. Thank you, panelists.
This is someone you care about. This is their new baby. You love them, and now you love them, and they need your help. Babies should sleep on their back in a crib or pack and play with nothing but baby every sleep. But safe sleep is hard, and when they're exhausted, it's even harder. So here's where you come in. Don't wait for an invite. Just hold the baby. Just change a diaper. Just showing up could be a lifesaver.
Great, thank you. And so tonight, we are centered on real talk and real solutions. As the video highlights, parenting is not easy and sometimes it gets exhausting, but we have ways to help moms and families get through these moments. For our next segment, we have, once again, Dr. Dixon. Good to see you again, Dr. Dixon, so soon. We also have Olivia Atlee and Seneca Bean. Thank you for being here. Get my page here. Dr. Dixon, you talked about you wear 2 hats. Right now, you're going to wear your Moms to Be hat, so thank you. We know Moms to Be provides weekly education and support sessions to high-risk pregnant women to promote healthier lifestyle choices and link them with resources. It's a high-touch, high-engagement approach and centers on meeting the needs for mom and families where they are. What are your learnings about the realities of practicing safe sleep, and what moms need from a showing, sharing, and supporting perspective?
So the wonderful thing about
We might want to switch. There you go. Is that one?
all right.
No? Where's our sound guy?
Okay. Maybe.
There you go.
Cool. So the wonderful thing about our program is that we are a multidisciplinary program. So we have myself as a OB, we have nurses, we have dietitians, we have patient navigators, we have early childhood educators. So we have a diverse team, and central to our mission is making sure that we're providing this education to everybody. And we embed it in our education weekly. So we always talk about the ABCs of safe sleep, and we talk about it in a community way. So with the consistency that we have with our sessions, people feel comfortable to ask questions, and we share how difficult it is in the first couple of days. Your baby's crying. How do you get the baby to the crib safely? And I think that building that community and making sure that they know that we're there is one of the most important things that we do.
Great, thank you. Olivia, switch the mic back, thank you. We all have a role to play in supporting moms, dads, families to help prevent infant deaths. Siblings, grandparents, aunties, I'm an auntie, uncles, godparents, friends, the sitter, and more are all a part of the village, and to use the mayor's term, messengers. So talk to us about the importance of support systems, especially when parents are tired or they're managing multiple challenges. Maybe they're working a couple of jobs or they have erratic schedules. How can we support these individuals, and what kinds of extended practices, if you will, can you share with the village and the messengers to make sure that we're doing our part?
Thank you. So what I find is that as a doula and as a recently delivered mom myself is that we often forget in the village to take care of the mom or the caregivers, the father, whoever's living in home with that infant, right? So if you have mom and dad, if you have auntie and mom, if you have grandma and mom, we're forgetting to take care of those people. So for me, the biggest message to share with the village is that those people need just as much care, because those are the people that are taking care of the baby on a very regular and consistent basis. And if they're not supported, if they don't have the things that they need, it's easier for them to do things that they may not have thought they were going to do in the beginning, like putting their baby down, using the ABCs of sleep, correct? When you're tired, when you're exhausted, you have a very higher likelihood to do things that you hadn't intended to do, right? So if they're not getting the support, if they're not getting sleep, if they're not getting rest, if they're not eating, if they're not taking care of themselves, they're not going to always do what may be the best. So my biggest message is to provide that support. So when families or people that you want to go visit because they've had a new baby, it's not just go hold the baby, hold the mom, yes? Hold the dad. Stand in those gaps. I think I lost it. We'll try again, we'll keep playing this.
We're down to one mic, so.
Nas said that's all you needed was one mic, so here we are.
Yeah.
It's so important that I say this because the tradition is to go take care of the baby, make sure that they have what they need, but we forget that those other folks need support. So I encourage us all that when we step into those spaces that we take something to take care of the family who's taking care of the baby, because they're gonna take care of that baby. That baby's gonna be well cared for and loved. We have to wrap our arms around the mom, the person who just gave birth. There's a lot that they go through, we go through after birth that we don't talk about. And there's this awful idea sometimes that we have to be superheroes after we have children, and you don't need to. It's okay to be vulnerable. It's okay to get help. It's okay to ask for help. It's okay to need support. And I think that's one of the major things that as a parent, we forget that it's okay to do. It's okay to call your mom. It's okay to call your grandma. It's okay to call your best friend at 1 o'clock in the morning because I really, really want to put him on his stomach, because I know if I put him on his stomach, he's going to sleep for a longer period of time so I can get some sleep. And that's what I want. And you need to have a friend in a village that's going to say, I understand. I need you to put the baby down on his back. And I'll stay with you on the phone if I have to. Do I need to come to the house? So it's even about how do you learn to build the village of people who are going to support the choice that you have made and how you're going to care for your child.
Thank you. Thank you, Olivia. Build the village that's around you and hug the mom and hug the dad and hug the caregivers. Thank you. Seneca, thank you for being with us tonight. You courageously share your story of loss to help others from a prevention perspective, but also from a healing perspective, with the goal of helping families avoid a tragedy. why was it important for you to be here tonight? And most importantly, why do you tell your story of the hurt, but also of the healing and the hope? Why do you share that?
Thank you, first of all, for having me and letting me join this conversation. You know, one of the things that I think about, so I'm an educator by day, right? And so when you're in education, you often think about your why. What is your why for what you're doing? But when you're in this space, as a parent who's experienced loss, that why becomes very clear. And so I share my message so that other mothers will not have to go. If there are preventable deaths, we need to practice the safe ABCs of sleep. Because if we can prevent a death, if I can share a message through my pain, through whatever hurt, there were many times that there were tears, but the tears I'm able to get through now and have conversations with people. I was actually a school counselor, and one of the most humbling experiences was being a mother to experience child loss and helping a student that have experienced child loss, or helping another mother that's experienced child loss. And I've had to do that. And so I know that if I talk about it, Black women, we don't talk about a lot of things. We carry things, we shoulder things, but we don't talk about it. And so being able to break that silence of infant loss, being able to spread messages to help people to not experience what I experienced, because one baby lost, there's a family attached. I heard that this evening. I have a husband, I had other children, I have parents. Sister Gilliard was there the day after she passed. Having that village is important, but it is a village. It is a family that is impacted by this. And so that is why I share my story and why I'm here.
Thank you, Seneca. Thank you so much. Olivia, as a doula, what do you see as the biggest issue when it comes to getting people, families, to practice safe sleep? We have the resources, we have the conversations. What do you see is the biggest issue for consistency around that?
I think one of the greatest issues is that it's easy to start, right? The first few days, it's simple. You're able to swaddle that baby and they rest. And then they start to grow and swaddling no longer is safe. So now what do I do to get to the baby in this position, in this state where they will rest well through the night? And learning other ways to care for your infant, to soothe them, to help them to rest well and to rest for a longer period of time can be challenging if you don't know what to do. So I think the greatest issue is further education on how to soothe and care and rest and help your baby to rest, and not that they have to sleep for 5 hours or 4 hours day 3. However, we do want longer spans of sleep so the family can get some rest as well. And what I have a tendency to see within the African American community is that culturally that's not how we set our baby to sleep. So if you have an intergenerational family in the house and you have grandma saying, girl, that's not how you put that baby down. Let me show you what to do. And I'm 14 and I'm having a baby, how am I going to argue with my grandma to put this baby down? Yeah. But if grandma has the information, if she has the knowledge, if she has the education, if every single person that's going to touch this baby at some point in time has this information, then we are more likely to see fewer of these deaths.
Thank you, Olivia. Seneca, we talked about consistency, the resources, the tools, all the resources that we have available today and the support systems. Do you still see any gaps in those systems? Anything else that we as a community, as a village, should be thinking about to support our moms and our families?
Well, I will say one of the things that I'm happy about are forums like this where we are able to really take a real look at what's happening in our community and to be intentional about a call for help, right? A call to action, I will say, for the community, because I did hear it is a community that will help And again, as you said, everyone has to practice the safe sleep, and you have to be able to educate your village. And so I think that in terms of gaps is just really keeping that education, being consistent in the message and making sure that everyone is consistent. Because as you said, if grandma's telling me, put the baby down like this is what we've always done, nothing's wrong with that, it's hard to counter that. But we know that the why is very important. This data that we have is real. And each baby, again, there's a family that's impacted, and so really that consistency in the message.
Great, thank you. Any final thoughts before we shift to Dr. Dixon? I see that smile. She's like, I got one more thing. Go ahead, go ahead.
I really just want to echo what everyone has already said. I think it's really, of course, it's multi-pronged, but the first thing is talking about it. The fact that we have all these people in this room here today because we're all committed to changing this is huge. I think the other thing is that we really need to look out for each other, right? So do you have a safe place for your baby to sleep? Do you have food to eat? Do you have safe housing? Do you have a safe place to work out? I mean, I think, when we think about the social determinants of health, there are so many other factors that every single one of us can help each other out. So that's just my last thought.
Thank you so much. Thank you, Dr. Dixon, for wearing two hats tonight. Olivia, thank you so much. Seneca, thank you for sharing your story and inspiring us and making sure that we continue to be the messenger that we need to be. So thank you. And now I'd like to ask Director Stapleton to join me back on the stage as we talk about our call to action, real stories and real solutions. Please give our panelists a round of applause.
I'm going to cheat here, and as I'm sitting down, I'm going to recognize a couple of people because I think it's important for us to understand who lifts us. I understand we just got a visit from Senator Herschel Craig.
I did.
So, Senator, thank you for being here. And then CelebrateOne has a nonprofit board of directors who help us raise money and illuminate the issues facing our community. And we have two board members here tonight, Christina Brown from Huntington Bank and a parent representative, Rebecca Howard. Thank you for letting me do that.
No, it's your show. I mean, thank you for having me here. Okay. Director Stapleton, we have covered a lot tonight. And we know that CelebrateOne continues to drive deep into the community, working with partners such as those here tonight and others. I have a series of questions here for you. So we're going to go through them as fast as we can. Talk to us about CelebrateOne's plan for the next 30, 60, even 90 days.
We are excited about the 30, 60, 90 because we have to do something different. What we have been doing, obviously post-pandemic, isn't working. And so the first thing that we are going to be doing is expanding doula services for parents. Those who are high risk, those who are later in their pregnancies but need support, 25 weeks and up, will have access to doula services if they call CelebrateOne and connect with a community connector. In addition, we know that there's some movement around the country to expand doula services to everyone, regardless of their financial ability to pay. If we got that opportunity in this state and in this city right now, we wouldn't have enough doulas to go around. And so in the next 60 days, 90 days, you'll hear about a doula education program where we'll be training the next generation of parent helpers, parent supports, to help a mother pre-pregnancy, during pregnancy, and post-pregnancy, and during the pregnancy process. So we're really excited about that. And then we've heard ABCs, 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 but we've also heard the how-tos are kind of hard, especially when you're tired and you don't have the support. And so we will be training all of our community health workers to be trainers for parents on the how-tos. Is the lighting the right way? Have you fed at the right time? Are you doing everything that you can so that when that baby can't be swallowed, to Olivia's point anymore, the environment is that which is necessary in order to get a baby to sleep. And so our community health workers in the coming months will be sleep trained and sleep certified to offer those classes in our communities through our recreation centers and other public locations. And so we're really, really excited about that. You've seen some of our videos. We're going to continue to advance those videos and create more on the how-tos. Again, lighting and when to breastfeed and how to actually keep the correct temperature in a room before it's time for a baby to go to sleep. And so you'll see those how-to videos coming online very shortly. And then finally, we, in the next 90 days, we have been working for the last 6 to 8 months on how to drive our performance based on data that is now down to the census tract level. If I can see on a 5-year trajectory that there are 3 census tracts, and actually we're sitting in one of them, Brother Murda, Ms. Jackie, we're working over here in 43232 because we know that there are census tracts that have greater issues with infant mortality. And so we're now down to the census tract in terms of doing strike activity in these neighborhoods and in these census tracts in order to turn the tide. So we will be sending out specific information to those communities. We'll be using utility bills to spread the message on how to get a baby to sleep. We are doubling down on how to get community education to people where they are.
Great, thank you. What other things will we see or see differently that will help drive behavior and change in our community?
You will see an increased level of public education. We are lucky to have a great partner in Orange Barrel that puts up billboards all over. You'll see an increase in that. You'll see an increase in our social media. And we're going to ask that you like, share, and give all of the information that we're out to your communities and your friends and your families, because that will help us spread the message. But we're also going to be asking all of our partners, all of the folks who have helped us get thus far, to help us a little bit more. Let's do another training in your facility. Let's get more people who may not have the messages of safe sleep and the how-tos, the information they need. And so we'll be reaching out to all of our churches and all of our community-based organizations and all of our lead entities to see how we can stem that tide.
Great, thank you. So you want us to all tweet, retweet, I don't know what you do on TikTok, but whatever you do, you want us to do it to spread the word, right? Fantastic. Where can moms get these resources that you're speaking of?
614-570-3592. Today, you can get CelebrateOne in that number by texting us, leaving a message. We'll get back with you. We have a QR code for everyone here in this community. If you know someone who's in need, you can take a picture of that QR code and it will take you to our external referral tool, which will get in touch with a community health worker within 24 hours. So you can utilize that telephone number or that QR code on the screen to get in touch with us.
Great, thank you. And then last question that we have time for. How can the community get involved?
Visit CelebrateOne's website at columbus.gov/celebrate-one. Sign up and help us spread the word on our ally and ambassador training. We still need to train our community on the ABCs of safe sleep. When we have those trainings available on the how-to, help us get that information out to our communities and our moms and our families and our babysitters and all those others that are taking care of newborns. Make sure that everyone in your life is being held. Everyone knows a neighborhood or a neighbor or a family member who might have a small one. Look in on them. It makes the difference, and make a commitment to do that. Encourage mothers and fathers to join support groups like Moms to Be, like Dads to Be, like the programs here at Mother's Cove with Miss Jackie and Brother Murdaugh. We have great community resources and group trainings available and group supports that are available to all parents. So everyone in this community can play a role, everyone. It's just deciding today which role that will be.
Great, everyone. Thank you, Director Stapleton, for all you do to lead Celebrate One in collaboration with your many partners. I want to thank all of our panelists for being here tonight for a very important conversation that we will continue to have. A special thank you to Mayor Ginther for keeping infant mortality a priority in Central Ohio. To learn more on how you can reduce sleep-related infant deaths in our community, visit columbus.gov/celebrateone or call 614-570-3592. Also, as Director Stapleton said, be sure to follow Celebrate One on Instagram, Facebook, and Twitter, and subscribe to Celebrate One email list for updates on events, resources, and more. That is all the time we have tonight, so thank you all for being here. And remember, let's do our part to reduce sleep-related deaths in Central Ohio. Now, we're going to stop the program and get to work. Thank you.